So what this is an image of basically the systemic circuit. Okay, an incredibly simplified image of the systemic circuit. You can see that this right here is the left ventricle, and as the left ventricle contracts, it pumps the blood out into the systemic circuit. By that I mean into the aorta. Then the blood travels throughout the systemic circuit, meaning first it travels to the arteries. From the arteries, right, the arteries become smaller and smaller and then become arterioles. The arterioles branch into capillary beds. Then the blood goes from being oxygenated to deoxygenated, and then the blood travels through the veins, right? First the venules and then the veins, back to the right side of the heart. So this is a simplified image of the systemic circuit, right? The arteries are carrying the oxygenated blood away from the heart, away from the left ventricle. Then the arteries ultimately deliver this oxygenated blood to the capillaries here, right, the capillary beds. Then there's an exchange of oxygen and nutrients. The blood becomes deoxygenated, and then the veins take the deoxygenated blood back to the right side of the heart. Now, the purpose of actually looking at this is to look at the what's called mean arterial pressure. And let's just for now call that average pressure because we're not going through the equation right now. It's just the average blood pressure, right, in the arteries versus the veins. Okay, so we can erase this and we can say, well, what's the average pressure within the systemic arteries versus the systemic veins? And you can see the average, what's called systemic arterial pressure, is around 90 millimeters of mercury. Okay, that's the average. Like if you take systolic and diastolic and you average it, the average systemic arterial pressure is around 90 millimeters of mercury. The average venous pressure, the average systemic venous pressure, meaning the average blood pressure within the systemic veins, is close to zero, right? It's not actually literally zero, but to make things more simple, oftentimes textbooks, especially more introductory and intermediate textbooks, will just say, since the blood pressure within the systemic veins is so low, we're just going to say that it's zero to simplify. So what's the point of saying this? I mean, what is all of this? This is a comparison between the pressure within the arteries and the pressure within the veins in the systemic circuit. And look at the difference in the pressure gradient, right? It's 90 in the arteries and 0 in the veins. And what's the purpose of saying that? Well, think about the flow equation. What's one of the huge things? What's flow proportional to? Flow is proportional to the pressure gradient. Well, look at this. Look at the pressure gradient, right? The blood pressure gradient between the arteries and the veins. It's literally, in our example, 90 millimeters of mercury on average in the arteries and 0 millimeters of mercury on average in the veins. So there is a huge blood pressure gradient between the arteries in the systemic circuit and the veins in the systemic circuit. Now, this applies also to the pulmonary circuit, but it's just not as significant. Okay, so again, we're going to continuously focus on the systemic circuit. And look at this pressure gradient. What should this tell you? Because of this huge pressure gradient that exists between the systemic arteries and the systemic veins, blood is going to flow from the systemic arteries towards the systemic veins. Blood is going to move from high pressures to low pressures, and the blood pressure within the systemic arteries is very high, while the blood pressure within the systemic veins is very low. So blood naturally moves from the high pressure systemic arteries towards the low pressure systemic veins. That's the first part of understanding the flow of a fluid, in this case blood, through a circuit, in this case the cardiovascular system. The fluid or the blood is going to move from a higher pressure towards a lower pressure. So this yet again is looking at the systemic circuit, and it's looking at what's the pressure within the systemic arteries, the blood pressure within the systemic arteries versus the blood pressure within the systemic veins. And as you can see, within the systemic arteries, if you average it out, the blood pressure within the systemic arteries is about 90 millimeters of mercury. The blood pressure within the systemic veins is so low that they oftentimes will just say 0. To really understand why there's a difference in pressure, why there's high pressure within the arteries and low pressure within the veins, you actually have to go through what would be referred to as the pressure equation. How do you figure out kind of mean blood pressure within an artery? But we're not going to do that right now, because I can promise you that will confuse you more than it will help you. So without using an equation, I'm going to explain to you on a sort of basic level, without actually looking at any equation, why the pressure is higher in the arteries and lower in the veins. And then at the end of the lecture, we'll actually go through the equation. And at that point, I think it'll make more sense. It'll still be quite confusing, but it should make more sense than if I were to try and do it right now. So this is a comparison that you've seen before of the arteries, arterials, capillaries, venules, and veins. All right, so first of all, what happens as the arteries move further and further away from the heart? They get more and more and more and more narrow. This image does an okay job of depicting that, but it makes it look like the lumens, the hollow opening in the center, stays exactly the same size, which isn't true. So good picture, but also not the greatest. It's actually showing you the internal diameter right here, right, in millimeters. It's going from 4 in the larger arteries to 0.03 in the arterials, but they do kind of an awful job of depicting that, or trying in any way to depict that with the actual pictures themselves. So you just kind of have to imagine yourself that as the arteries get further and further away from the heart, they simply become more and more narrow, right? They just become smaller and smaller and smaller and smaller. Now, what that actually means is that something called the resistance, we'll just call that R, okay? The resistance is increasing. The resistance to blood flow. We're not going to talk about resistance in a ton of detail this second, but to make sense of it, it's quite easy. So imagine that you are drinking water through 2 different straws. You're drinking water, one through a straw that you got from McDonald's, and you're going to drink water also through a coffee straw. Okay, this is the McDonald's straw, and this is the coffee straw. Okay. If you drink the water through the McDonald's straw versus the coffee straw, which one are you going to be able to get more fluid into your mouth faster with? The obvious answer to this is, right, the McDonald's straw. You're going to be like, okay, if you had a glass and both glasses were filled with the same amount of water, okay? If both glasses were filled with the same amount of water, you could empty the glass with the McDonald's straw much faster than you could empty the glass with a coffee straw. This is logical. Again, you can figure this out mathematically why this happens, but for our discussion right now, it's not necessary, right? It's kind of common sense that if you have a straw that has a very wide diameter, you can drink fluid through it much faster than if you have a straw with a much more narrow diameter. Now, the explanation for why it's so much easier to drink water through a straw that has a very wide diameter compared to a straw which has a very narrow diameter, the explanation for that is because there's less resistance to the flow of the fluid within the wide diameter straw compared to the narrow diameter straw. Because there's such a narrow diameter, internal diameter, lumen, as we would say, within the coffee straw, that creates a lot of resistance to the flow of the fluid. And again, that's due to the very narrow diameter that the coffee straw has. Because it has such a narrow diameter, there's lots of resistance to the flow of the fluid. And thus, the fluid moves through it much more slowly compared to the straw that you got from McDonald's. Because the straw that you got from McDonald's has a very wide diameter, internal opening, and there's less resistance to the flow of fluid. So what happens is the fluid flows through it very easily and thus very fast. So then you can take this knowledge and you can apply it to these different vessels. Okay, think of an artery versus an arterial versus a capillary. Which one of those is going to have the highest resistance and which one of them is going to have the least resistance? Okay? The clear answer to this is the largest arteries with the largest internal openings, like largest diameter lumens, are going to have the least resistance. And as the lumen of the vessel becomes more and more and more and more narrow, like going from a McDonald's straw to a coffee straw, as the internal opening, as the lumen becomes more and more and more narrow, as you move from larger arteries to arterioles to capillaries, the resistance just keeps increasing, right? There's more and more and more and more resistance to blood flow as you get further and further and further away from the heart. As the arteries become smaller and smaller and smaller and smaller, and their lumens become more and more and more and more narrow, there's greater and greater resistance to the flow of the blood, to the flow of the fluid. Knowing this helps us explain why this is part of what helps us explain why blood pressure is so much higher within systemic arteries than it is within systemic veins. And let me try to explain that. So you've seen this before. Here are the arteries. Here are the veins in the systemic circuit. Now what happens? The left ventricle contracts, and the left ventricle incredibly forcefully ejects blood out into the systemic arteries. Okay. Now, the systemic arteries are going to lie kind of closest to the left ventricle. And when the left ventricle contracts and it forcefully ejects blood out into the arteries that lie very close to the left ventricle, that creates a lot of pressure within these systemic arteries. Now, there's another reason that there's a lot of pressure within these systemic arteries, but we'll save that for a little bit later. Okay, so the left ventricle contracts, and it forcefully, very forcefully, ejects all this blood from the left ventricle out into the systemic arteries. And I mean, if you think about that, right, if the left ventricle is here, and it incredibly forcefully ejects blood out into the systemic arteries, that's going to create a lot of pressure within these systemic arteries. They lie closest to the left ventricle, and thus they have to deal with a lot of that pressure, blood pressure that's created from the left ventricle ejecting blood out into them so forcefully. But the thing is, additionally, they have they're very large vessels, and they have large internal openings. So blood actually flows through these arteries quite well, right? It flows through the arteries relatively easily, but at the same time, there is a lot of pressure that's generated in these arteries as well. And this isn't a complete explanation. I acknowledge that. Okay, there's more to why this is the case as well, but I'm trying to take it one step at a time. Now, as the arteries move further and further away from the left ventricle, what happens to them? They become more and more narrow, right? I'm saying that this is a vessel, this is a vessel, and this is a vessel, right? As the arteries get further and further away from the left ventricle, the arteries become smaller and smaller and smaller, more and more and more narrow. Now, what does that mean for blood flow? Right? As the blood is traveling through more and more and more narrow vessels, it's like blood traveling from the McDonald's straw and slowly beginning to travel through more narrow straws, like coffee straws. The flow of the blood is going to decrease as it travels through more and more and more and more narrow vessels, through more and more narrow arteries, right? Smaller arteries. Why? Because these smaller and smaller arteries are creating more and more resistance, which is continuously slowing down the flow of blood through these more and more narrow vessels. And then you say, well, what effect is that going to have on pressure? As the blood travels through more and more narrow vessels and the flow of the blood decreases, because we can assume that that's happening. As the blood gets further and further away from the left ventricle, the flow of that blood is decreasing. And here we can get to the second part of the equation. What is flow equal to? Flow equals, let's just first of all say that it is proportional to a pressure gradient. Okay? The greater the pressure gradient, the more flow you'll get. We know that there is greater pressure within the arteries, systemic arteries, than the systemic veins, but that's the part that we're trying to explain right now. What is flow inverse to? Flow is inverse to resistance. The greater the resistance, the less blood flow you will get. These equations are incredibly confusing to actually think through conceptually, but again, try to stick with me. This is explaining to you why there is a decrease in flow as the blood gets further and further away from the left ventricle. The arteries narrow and narrow and narrow and narrow and narrow, get smaller and smaller and smaller and smaller. That creates more resistance, as I've shown you here, which decreases the flow of blood, like drinking water through that coffee straw. A big determinant of pressure is actually how much fluid is flowing through a particular vessel. It's a huge determinant of pressure, an enormous determinant of pressure. Okay, and what do we know as we get into smaller and smaller and smaller vessels? The flow of the blood, the flow of the fluid, just keeps decreasing due to the increase in resistance that there is. So, let's think of the flow of the blood through the arteries versus the veins. Blood is going to flow through the arteries much more effectively, much more fast, than it's going to flow through the veins. Why? I think we've established that as the arteries get further and further away from the left ventricle, they become more and more narrow, creating more and more resistance to blood flow, which decreases the flow of blood. So by the time that you are within, let's say, the venules and the veins, right, the flow of blood has been decreased to essentially, I mean, it's not nothing, but it's very, very slow, low. The actual flow itself, the flow of the blood through the vessel has decreased substantially from what it was within the arteries. And that decrease in flow actually translates into a reduction in pressure. All right, so let's try to tie all of that together. Now, I acknowledge there are portions of these different equations that are missing, right? So this is unbelievably confusing to go through. I put it almost on the same level as something like metabolism. Okay, it's very confusing, and you have to pick what parts to go through first. And the first parts won't make as much sense because you're not actually getting the other parts. But if you talk about the other parts before you talk about the first parts, it makes the first parts really confusing. So it's very challenging to be able to teach this. So let's just try to establish what we have, what I've been trying to say up to this point. Okay, we need blood to flow from the arteries towards our veins. Okay, and in order to do that, flow is proportional to the amount of pressure within the arteries versus within the veins, right? Flow is proportional to the pressure gradient, right? So you need there to be high pressure within the arteries, and you need there to be low pressure in the veins if you want blood to flow from the arteries towards the veins, which is exactly what we want within both the systemic and the pulmonary circuit. So we need there to be a pressure gradient between the arteries and the veins. It has to exist. And the greater that it exists, theoretically, again, there's parts of this equation that are missing. So if you think about this too much, you'll notice that there are faults in it. And that's just because we haven't covered enough yet. But theoretically, right, when you increase the pressure between the two ends, you get an increase in flow, right? Because if there's a bigger pressure gradient within the arteries versus the veins, that should cause an increase in the flow. Now the question is, why does this pressure gradient exist in the first place? And there's parts of this that are missing, okay? But this is the first component. And you say, well, the actual pressure gradient exists partly because of the resistance, right? Flow is inverse to resistance. Okay? The more resistance that you have, the less flow there will be between, or let's say, the more resistance that you have, the less flow there will be throughout a circuit. And this actually helps us understand what establishes the pressure gradient, which is what's needed for flow, which is why all of this is so confusing and why there's more to discuss than just this. Okay, but where is partly where is this pressure gradient coming from? Why is there high pressure within the arteries and low pressure within the veins? And part of the answer, not the whole answer, is because of the resistance that exists. Right? As the blood travels through the arteries and the arterioles and the capillaries, you get more and more and more and more resistance because these vessels just keep getting smaller and smaller and smaller, creating more and more resistance, and that creates a reduction in blood flow. And that reduction in blood flow, this is only part of it. Okay? Yet again, I have to keep saying that. This is only part of it. But that reduction in blood flow causes an actual reduction in pressure, right? So what does that mean? Blood flows through the larger arteries quite nicely, quite easily, right? And then as the arteries become more and more and more narrow and there's greater and greater resistance, the flow of blood is reduced downstream. And that reduction in the flow of blood downstream causes a reduction in blood pressure, for example, within the venules in the veins. It's a significant reduction. Because by the time that the blood is flowing through the venules and the veins, it is significantly reduced due to all of the resistance within the circuit compared to the arteries. And let me also say this, because now we're going to start getting into more so the pressure equation itself as we progress. That resistance that exists, especially within the arterioles and the capillaries, right? The vessels become more and more narrow within, as we talk about the arterioles and the capillaries, and that increases significantly the resistance, right? There's two things going on here. That will cause a reduction in flow within, every subsequent vessel, right? As the arterioles become the capillaries, and as the arteries become the arterioles and the arterioles become the capillaries, right? The vessels just becoming more and more and more and more narrow, decreasing the flow of blood due to the increase in resistance. So by the time that we get into the venules and the veins, right, there's been a big drop off in the actual flow of blood. Which causes a decrease. Partly, there's more to the equation, but that partly contributes to the decrease in pressure. And at the same time, I want you to realize this. Upstream, what's that resistance doing? right? Since these vessels are so much more narrow, the arterioles and the capillaries, and they create lots of resistance, right? That actually causes a backlog of blood, of fluid upstream, right, within the actual arteries themselves. And that actually further drives up the pressure within the arteries. So this resistance actually contributes to a reduction in pressure downstream within the venules and the veins, and an increase in pressure within the vessels upstream. Because that resistance, as the vessels are becoming more and more narrow and there's more and more resistance, it causes a backlog of blood to exist upstream, right? The blood kind of gets, it's backlogged. It's like think about it as I've said with other examples, like a traffic jam. It causes a backlog of blood upstream, and that increase in the amount of blood upstream actually helps increase the pressure within the vessels that exist upstream, and it causes a decrease in the pressure of the vessels that exist downstream. So yet again, this is going to be real confusing, but the flow of blood equals the pressure gradient divided by the resistance. And again, get ready to be confused, but if you get an increase in resistance, right, you're going to get a decrease in flow. Absolutely, right? The more narrow the vessels are, the more resistance you have, and at least as we speak downstream, you're going to get a reduction in blood flow, which is going to help in a reduction in pressure. But at the same time, you actually need this resistance to exist to partly create the pressure gradient in the first place. You need this resistance actually to exist partly in order for there to be higher pressure within the arteries and lower pressure within the veins. Because that resistance partly, I keep saying that word intentionally, because that resistance partly is what's causing the reduction in blood flow within the venules and the veins, and thus a reduction in blood pressure. So absolutely, as you get an increase in resistance within a circuit, it's going to hamper the flow of blood, but it's also going to help increase the pressure gradient between the two ends to some degree, which will actually have a potential influence and cause an increase in flow based upon that part of the equation. And that should sound unbelievably confusing and contradictory, and it all is. And that brings us to a more complex conversation of the cardiovascular system, which is you can't just be thinking about this entire system as, just being this uniform unit, right? There's lots of different things going on in different parts of the cardiovascular system, meaning the vascular system itself, at the same time. So you actually can't think about these equations in reality as applying to the entire body, to the entire cardiovascular system. You actually have to think about how they apply to individual sections of the cardiovascular system based upon what's happening in those specific areas. That's actually the only way that this stuff begins to make more sense. Okay? And that's what we're going to start talking about now. So before I continue on, I do want to show you this from your text. It shows the pulmonary circuit as well. And it's just showing you that the pulmonary circuit functions identically as the systemic circuit, right? The average pressure within the arteries is much higher than the average pressure within the veins within the pulmonary circuit, and that's why blood actually flows from the pulmonary arteries towards the pulmonary veins is due to this pressure gradient. What mostly establishes this pressure gradient? Well, the resistance that exists within the circuit itself. There's plenty of resistance that also exists within the pulmonary circuit, which causes a decrease in blood flow, which helps cause a reduction in the amount of pressure within the veins versus the arteries. So it's the same thing. That resistance causes a reduction in flow, but at the same time establishes the gradient that's necessary for the flow. I'm not going to get into any of this in this course because there's no time for it, but you'll just notice that the actual pressures within the pulmonary circuit, within the arteries themselves, are a lot less than the pressures that exist within the systemic circuit. And to get into why all that would be the case, you'd have to get into where the actual pressure equations come from, which we're going to do later on, but we're not going to apply to the pulmonary circuit. I just wanted to point this out to you, that the same dynamics of flow, of course, apply to the pulmonary circuit as the systemic circuit. So the only way that we can make sense of all of this is to actually apply it to something, right? And then I think a lot of it starts to come together. So let's think about physical activity, because that's what the fight or flight or system, the sympathetic nervous system, is really designed to assist with. Okay? So you're engaging in physical activity. Okay? What's happening? You know that your sympathetic nervous system is going to be activated when you're engaging in physical activity. This is showing the sympathetic nervous system, right? It's showing the thoracic nerves and the sympathetic neurons traveling through those thoracic nerves. Now, one of the places that we go that the sympathetic neurons travel to through the thoracic nerves is the heart. What does that do to the heart? It causes heart rate to increase. It causes stroke volume to increase. And we know that heart rate times stroke volume equals cardiac output. So the sympathetic nervous system is, of course, going to increase cardiac output. It's going to increase the amount of blood circulating around our body per minute. Now, here's the other thing that we haven't discussed. The sympathetic neurons also travel out to really all of the systemic arteries throughout your body. These sympathetic neurons, when you're engaging in physical activity, when there's a sympathetic response, like during physical activity, these sympathetic neurons are going to release norepinephrine onto really all of the systemic arteries in your body, just like they release norepinephrine onto the sinoatrial node and onto these ventricular fibers. So then the question is, well, what does this do? What does the sympathetic nervous system releasing norepinephrine onto systemic arteries actually accomplish? The answer is, when sympathetic neurons release the neurotransmitter norepinephrine onto systemic arteries, pretend that this is one right here. What it does is the norepinephrine actually binds to the smooth muscle cells within the tunica media, and the norepinephrine causes them to contract. I'd love to go through the whole pathway with you, but that's also not something that we get to cover in this class, which is really smooth muscle. Okay? All I can tell you is norepinephrine causes these smooth muscle cells to contract. And when these smooth muscle cells contract, what that causes is for the lumen, the internal diameter, to narrow. Right? The diameter decreases. That is what the sympathetic nervous system does to systemic arteries. When the sympathetic nervous system is activated, it really releases norepinephrine onto all of the systemic arteries in the human body, and it causes what's called vasoconstriction right here in all of them. Right? The norepinephrine binds to the smooth muscle contracts, and the blood vessels vasoconstrict. What that really means is that due to the smooth muscle contracting, the internal diameter, called the lumen, becomes more narrow. Which brings us to a different question. What is that doing? And the answer is, what's it causing? If you vasoconstrict these arteries, and by the way, the main type of artery that this happens to, it happens to really all of them, but the most important ones that this happens to are the arterials. Okay? This mostly happens at the level of the arterials. I'm not saying it doesn't happen upstream in the larger arteries too, but the biggest place and the most important place that this happens is within the arterials. What are you creating? You're creating a ton of resistance. You're creating a bunch of what we call total peripheral resistance, sometimes total systemic peripheral resistance, okay, because we're really focusing on the systemic circuit. But this is something called total peripheral resistance. What's happening is it's increasing. Let's talk about what the term means. Total peripheral resistance is really exactly what it sounds like, okay? It's the amount of resistance that exists. Particularly, we're usually interested in the systemic circuit. So total systemic peripheral resistance, or just total systemic resistance. I mean, there's all kinds of different terms that can be used, but really it all means the same thing. What's the amount of resistance that exists within mostly the systemic circuit? What's the biggest thing that's going to influence that? How dilated or how narrowed the arteries, mostly the arterioles, are. Because what's the biggest thing that influences resistance? The biggest thing that influences resistance is how narrow vessels are. I think we've established that a lot throughout this lecture. The more narrow the lumen is, the more narrow the vessel is, the more resistance you'll have. Again, like drinking water through a coffee straw. So what's going to happen here? Like if the sympathetic nervous system is activated and it's releasing norepinephrine onto the systemic arteries, again, we're mostly focused on the arterioles, and that's causing those arterioles to vasoconstrict, to narrow, for their internal lumens going from like this to going like this, right? What is that doing to those arterioles? It's causing there to be a greater amount of resistance, right? There's more resistance. And what we would actually say then is there's an increase in total peripheral resistance. There's an increase in the amount of resistance that exists within the systemic circuit. Of course, that's what's happening. The sympathetic nervous system by itself, excluding all other possible variables and factors, what the sympathetic nervous system does is it causes an increase in total peripheral resistance by vasoconstricting the arteries by releasing norepinephrine onto them. Causes the smooth muscle to contract within the arteries, and thus they narrow, which increases resistance, and we say that that's an increase in total peripheral resistance. And now what we want to think about is what overall effect is that going to have? So think about this. If during a sympathetic response, what happens is the arterioles vasoconstrict, they narrow, you're going to create even more resistance, right, throughout the systemic circuit. There's more resistance now. And what's that going to do? That increase in resistance is going to further hamper the blood flow within the venules and the veins, which would further decrease the pressure within the venules or the veins. And upstream, right, within the arteries themselves, it's going to cause a greater backlog of blood, which is going to further increase the pressure. So yeah, you're going to get a decrease in flow throughout the systemic circuit once you get, you know, at the level of the arterioles, capillaries, venules. But you're actually simultaneously increasing the pressure gradient, which should help with flow. Now, again, on the surface, that should sound incredibly confusing and contradictory, but actually it ends up not being so. Now we can finally talk about also what actually dictates, you know, kind of mean arterial pressure, like kind of the average pressure within the arteries, or we can just say mean pressure, the average pressure within any vessel. So what determines mean arterial pressure? Okay. You're usually interested in mean arterial pressure, meaning the pressure, blood pressure within the arteries of the systemic circuit. We know that there's so little pressure within the veins that, again, oftentimes people aren't really interested in it. What they are interested in, and which is quite important, is what's the average amount of pressure within the arteries within the systemic circuit, because we know that's where pressure can really increase significantly. Okay, so how do we determine mean arterial pressure? Okay, again, you can apply this exact same equation, by the way, to the veins. I'm just trying to make the point that there's so little pressure within the veins, most people just aren't worried about the amount of pressure that exists within the veins. Okay, that doesn't mean there can't be diseases related to pressure within the veins, but there's so little of it that you'll oftentimes just hear mean arterial pressure, which is like, what's the average pressure within the arteries in the systemic circuit? However, please know that this equation applies to any vessel. All right, anyways, how do we get to it? Two things that you have to know. Mean arterial pressure, and again, I have to say it again, this applies to any vessel, equals cardiac output times total peripheral resistance. What we're focused on is what's the average pressure within a systemic artery. And we can very easily figure that out by taking cardiac output and timesing it by total peripheral resistance. So this should tell us something. Any increase in either cardiac output or total peripheral resistance will drive up the average pressure within a vessel. In this case, we're interested in the systemic arteries. Think about what's going on here. Okay? During exercise, during a sympathetic response, which is what happens during exercise, what's happening to cardiac output? We know that cardiac output is going way up. Right? Heart rate and stroke volume are increasing due to the sympathetic nervous system, due to the Frank-Starling mechanism. We're getting big increases in cardiac output, the amount of blood circulating around the body. What also are we getting? Theoretically, at first, it looks like we're getting a huge increase in total peripheral resistance because the sympathetic nervous system is causing all of these systemic arteries, mostly the arterials, to vasoconstrict, which is driving up total peripheral resistance. So we're getting an increase in both cardiac output and total peripheral resistance, which should, in theory, be causing a huge increase in mean arterial pressure. Well, now you say, what influence then is that going to have on flow throughout the body, throughout the systemic circuit? All right, here's the pressure within the systemic arteries. What's happening during exercise? During a sympathetic response, cardiac output goes up, and we would think total peripheral resistance goes up due to the big increase in resistance within the arterioles. So you think, why would cardiac output, first of all, cause blood pressure to rise? Well, you're just simply pushing more blood throughout the vessels, right? And if you're pushing more blood throughout the vessels, an increase in cardiac output, then of course you're going to get an increase in pressure. Why would an increase in total peripheral resistance drive up blood pressure? Again, especially within these arteries. Well, if these arteries are narrowed, there's a couple of things that are going to be happening here, right? You're trying to push more blood, right? There's a greater cardiac output. So you're trying to push more blood through more narrowed vessels, right? So the vessels are narrowed and you're trying to push even more blood through them. Right? You're trying to push even more blood through these really narrowed vessels, which is of course going to drive up pressure even more. Additionally, because of all this resistance that exists within these arterioles, again, it's kind of causing, in essence, a backlog of blood upstream, which also is driving up blood pressure. And then you might ask, like, what effect is this going to have on pressure within the venules and the veins? It's actually not going to have that big of an influence on the amount of pressure that exists within the venules and the veins themselves. Flow will be significantly reduced by the time that it gets into the venules and the veins, so that's not going to have as big of an effect. There will be some increase in cardiac output within the venules and the veins, but the flow itself will have been substantially reduced by the time it's in the venules and the veins. And the venules and the veins don't actually have a lot of smooth muscle, so they do vasoconstrict, but the amount of increase in resistance that is experienced in the venules and the veins is significantly less. So pressure within the venules and the veins actually doesn't go up that much. Again, the same equation, cardiac output times total peripheral resistance, applies to the venules and the veins, but the influence during exercise over them is really insignificant. So where you're really going to get big increases in pressure is within the arteries and really not within the veins. So you're going to create an even bigger pressure gradient between the arteries and the veins during exercise, during physical activity, during a sympathetic response, which is exactly, what you would think you'd want, because that in theory should increase blood flow. But what's decreasing blood flow? And what's decreasing blood flow is that big increase in resistance that you're experiencing, that big increase in total peripheral resistance within, again, mostly the arterioles, is actually decreasing the flow of blood. Like, that's not what you want. You do want this big increase in the gradient that exists between the arteries and the veins, because that, in theory, should help increase the flow of blood. But this resistance is inverse to flow, and it's actually having a negative effect on blood flow. So then you get into this question of, well, why during exercise would you want an increase in resistance within the arterioles? Why would you want them all to vasoconstrict? Because you could say, well, yeah, sure, the increase in resistance does help increase the pressure gradient to some degree, but it's also more significantly decreasing the flow of blood, and which is the opposite of what we would want during physical activity. We would want the amount of blood that's flowing through these vessels, especially to the contracting muscles that need the blood, to actually increase. And that's where all of this kind of starts to come together. Because if you think about all of these equations, I've said this a couple times, but if you think about all these equations as being like cumulative and applying to the entire human body, there's so many contradictions that just don't seem to make any sense. But then when you see what actually happens during a sympathetic response, during something like physical activity, I think it makes close to perfect sense. So during exercise, what's going to happen is, pretend that these are muscle cells, okay? These are muscle cells within a particular muscle that's contracting during exercise. If you're running, right, these could be muscle cells, muscle fibers that exist within the quadricep, hamstring, gluteal, calf muscles, I don't know. What are they doing? When you're exercising, they're contracting more. And when they contract more, they consume more ATP and they have to make more ATP. And in the process of making more ATP, let's say through oxidative phosphorylation, through the utilization of oxygen, they produce more carbon dioxide. And they also produce all kinds of other byproducts as well. Inorganic phosphate, adenosine, potassium leaks out of the, there's all kinds of things that begin to leak out of skeletal muscle fibers when they start contracting more. That's not a question that I'm going to ask you about a specific, metabolite that is produced by them. All I want you to know is that hopefully it should make sense. If these muscle fibers are contracting more, they're consuming more ATP, and thus they're making more ATP. And through that process, they produce metabolites, let's just say light carbon dioxide, that spills out of the skeletal muscle fibers. And what will those metabolites, like carbon dioxide and others, potentially do? The answer is, we know that these metabolites that are produced by these contracting skeletal muscle cells, these muscle fibers, they actually have the ability to travel over to the arterioles that lie next to them and cause the smooth muscle that lies within those arterioles to relax. Right? The actual metabolites that are produced by contracting skeletal muscle fibers cause vasodilation of the arterioles that lie next to them. Do you see what's happening in this image here? The metabolites being produced by the skeletal muscle cells, during this, while they're contracting, due to them contracting, the production of these metabolites actually causes vasodilation, relaxation of the smooth muscle within the arterioles that lie around them. Which leads into a very interesting conversation about what's actually going to happen to blood flow during physical activity. So when you begin engaging in physical activity and the sympathetic nervous system becomes active, the sympathetic nervous system is going to cause cardiac output to rise by increasing heart rate and increasing stroke volume, right? During physical activity, the sympathetic nervous system is going to cause you to pump more blood and thus oxygen around your body, which makes sense, right? Because there are cells that actually need more blood and oxygen in order to be able to make more ATP to meet their ATP demands. At the same time, the sympathetic nervous system is going to cause pretty much vasoconstriction of all of the systemic arteries in the human body. So we would think initially that's going to cause an increase in total peripheral resistance. Because all these arteries, mostly arterioles, right, they're going to vasoconstrict, they're going to narrow, which is going to increase the total amount of vascular resistance that exists throughout the systemic circuit. So these two things combined together, cardiac output and total peripheral resistance, equal the average or mean arterial pressure. So we should be seeing an increase in cardiac output and an increase in total peripheral resistance, which should be driving up the average pressure within the arteries. You're actually creating a greater pressure gradient between the arteries and the veins, which is great, right? Because that's exactly what you want. But you don't want there to be excessive amounts of resistance, right? That doesn't actually make any sense. Because if you increase resistance too much, what does an increase in resistance actually do? Right? Think about the flow equation. Blood flow equals a pressure gradient, which we have, right? Blood flow is proportional to a pressure gradient. We're increasing the pressure gradient. There's a greater gradient between the pressure within the arteries and the veins, which is what we want. But at the same time, flow is inverse to increases in resistance. Like flow is inverse to resistance. And now we've got a whole bunch of resistance, which should be decreasing blood flow. It doesn't make any sense, right? You don't want to decrease the amount of blood flow during physical activity when you're trying to get more blood flow to the contracting muscles. But then you say, well, what did we just go through? Well, the muscles that are contracting during this bout of physical activity, those muscle cells that are contracting are producing metabolites that are actually causing vasodilation of the arterioles that lie around the contracting muscles. Let's say this differently. The arterioles, all of the arterioles that lie around contracting muscles during physical activity, all of those arterioles are going to vasodilate. They're all going to increase their diameter. And then you think, well, what effect will that then have on resistance in those specific areas, specifically in the vascular networks that lead to contracting skeletal muscles? Resistance is actually going to decrease. The resistance of the, you can only really apply this, right? Because thinking about this on a whole body level is just really irrelevant, mostly, okay? At least for this discussion. In these isolated areas around contracting skeletal muscle, you're going to get a reduction in vascular resistance because all of the arterioles that are traveling towards contracting skeletal muscles, they're all going to vasodilate due to the metabolites produced by the contracting muscles. And what does a reduction in resistance mean for blood flow? Well, blood flow is inverse to resistance. So the point is, if you can reduce resistance, you're actually going to get a greater amount of blood flow. Think about the basically perfect situation you've created around your contracting muscles. You've managed to increase the pressure gradient between the arteries and the veins for all the reasons that we've discussed. Right? We're going to increase the pressure gradient. Right? You're increasing the pressure gradient. You're driving up mean arterial pressure. There's not much of a change in the pressure within the veins. Right? So you've driven up the pressure gradient while simultaneously you've driven down the vascular resistance in those areas. Blood flow equals the pressure gradient divided by the resistance. What you've done in these isolated areas is you've driven up the pressure gradient while driving down the resistance. So you're actually going to get an enormous amount of blood flow into these specific areas. What's really happening here, and I'll finish this in a second, is you're essentially shunting blood towards the contracting muscles because this same thing is not going to happen in the other areas of the human body. The arterioles leading to other organs, as you know, all these other organs that are depicted here, the arterioles leading to those organs are going to stay vasoconstricted because there's not metabolites being produced by those organs, which is driving vasodilation. So the resistance, within the vascular networks traveling towards these other organs of the body is going to stay elevated. And thus, what does that mean for blood flow to those areas? If the resistance stays elevated, towards, for example, the kidneys, the arterioles traveling towards the kidneys, thanks to the sympathetic nervous system. I'll erase total peripheral resistance here, but the arterioles taking blood towards the kidneys, right? They're going to stay vasoconstricted, and that's going to cause an increase in resistance and a reduction in blood flow. So what are you accomplishing here? You're vasodilating and thus reducing resistance to the contracting muscle, and you're vasoconstricting or increasing the resistance within the vessels, taking blood everywhere else. So what's actually being accomplished here is you're shunting blood towards your contracting muscle during exercise, during a sympathetic response, and you're moving blood away from everywhere else. Let's say that differently. The flow of blood towards contracting skeletal muscle is significantly increasing, right? Towards contracting skeletal muscle, the flow of blood is significantly increasing, while the flow of blood towards most other areas is either staying the same or it's actually decreasing. And this is exactly what you want, because, where do you want all of the blood to go during physical activity? When you're engaged in physical activity, you want most of the blood and thus the oxygen to travel towards the contracting muscles that need the blood and oxygen to be able to make the ATP, to be able to meet these demands of ATP that they have. And this is a graph showing you exactly what I'm talking about. So what this is looking at is it's looking at the total cardiac output, which is, about 5 liters per minute in the average person at rest. And it's saying, where is most of the blood going? Red is skeletal muscle, green is the skin, yellow is the brain, blue is the heart, and purple is other. Okay, well, as we begin to engage in more intense physical activity, what do we know happens? Cardiac output increases, right? Heart rate and stroke volume both increase, mostly thanks to the sympathetic nervous system, and you pump more blood around the human body. It has doubled in this image, right? It's gone from 5 liters per minute to 10 liters per minute. Look at proportionally, though, where the blood is going. It doesn't proportionally distribute to all of the organs. It's proportionally distributed and shunted pretty much exclusively towards the contracting skeletal muscle. Look at as the exercise becomes more and more intense. Look at severe exercise as it's listed, right? Cardiac output is 25 liters per minute. Look at the amount of cardiac output that's going to contracting skeletal muscle compared to all these other organs in the human body. What the body has accomplished during physical activity is it has essentially shunted almost all of the blood to the contracting skeletal muscle that needs it. Really, all the blood is flowing towards the contracting muscle and not other places. And you say, how is it possible for all this blood to be flowing towards muscle and other places? And that's where the equations come into play, right? What does flow equal? Flow equals this pressure gradient divided by resistance. Flow is proportional to the pressure gradient and inverse to resistance. How did we get an increase in the pressure gradient? Okay, well, first of all, what equals pressure? Pressure, we'll just say, pressure equals cardiac output times total peripheral resistance. You can clearly see during really intense physical activity, cardiac output, it's insane how much cardiac output goes up. It would seem like the sympathetic nervous system also causes total peripheral resistance to rise, but as you're about to see, if you look at the entire circuit as a whole, that's kind of not true. But no matter the case, no matter, even if total peripheral resistance, as you're about to see, doesn't really increase, because you have to look at the whole circuit as a whole, all the vasodilation and vasoconstriction happening simultaneously to figure out total peripheral resistance, it doesn't matter, because cardiac output increases so much during physical activity that no matter what happens with total peripheral resistance, mean arterial pressure, the pressure within the systemic arteries, is going to rise. There's going to be a bigger gradient between the arteries and the veins in terms of pressure, which is going to increase flow. And what's the other determining factor of flow? It's resistance, right? Flow is inverse to resistance. And what happens during a sympathetic response? We get systemic vasoconstriction initially, okay? Where's the only place that we don't get systemic vasoconstriction? Around contracting muscle. That's the point. The arterioles, let's say, leading to all these other organs are going to vasoconstrict. So you're going to get an increase in resistance leading to those, in the arterioles leading to those organs, which is going to do what to blood flow, right? It's going to have a negative effect on blood flow, the increase in resistance. Now, clearly you can tell from this equation, there's still a big increase in the pressure gradient, which is going to positively influence flow. So it's not like we're going to entirely cut off blood flow to these organs. It's still going to exist, but due to this dramatic rise in resistance, thanks to the sympathetic nervous system, there's actually going to be a reduction, or at minimum, no increase in flow to these other organs. Now, the arterioles leading to contracting muscles, right? Those arterioles are actually all going to vasodilate thanks to the metabolites produced by those contracting muscles. And that means the contracting muscles are actually going to experience a reduction in resistance, right? By that I mean the arterioles around contracting muscles, right, are actually going to have a reduction in resistance because they're going to vasodilate. So think about what's happening around contracting skeletal muscles. This is exactly what you want. You have an increase in the pressure gradient between the arteries and the veins, which is helping with blood flow, right? Because flow is proportional to the pressure gradient, which is increasing in between the arteries and the veins. And at the same time, around those contracting muscles, you're having a reduction in vascular resistance, which is, again, flow is inverse to resistance. So if you can reduce resistance, you're going to get an increase in flow. You're getting both things are helping with flow. You're getting an increase in the pressure gradient and you're getting a reduction in the resistance, meaning that blood is just going to flow like crazy to the contracting skeletal muscle, and it's not going to flow like crazy to the other organs of the body, which still have these big increases in resistance, which is hampering the flow of blood. So you're going to get all of this extra blood flow and thus all of this extra oxygen to all of the skeletal muscle that needs it during physical activity. And that's kind of the, as with regard to all of these equations, you can't think about any of them in a vacuum. You have to think about what's happening throughout the, different portions of the human body. To make sense of any of this. My point is, if you just tried to apply one of these equations to the entire human body, the entire vascular network, and you didn't take into consideration that there's multiple factors, and multiple variables going on, none of it would make any sense whatsoever. But when you realize what happens to the vasculature is different, for example, around muscle than it is around, for example, the kidneys, the equations and the whole picture, I think, makes a lot more sense. This whole idea of vessels dilating, like arterioles vasodilating and allowing more blood to flow to particular regions of the body due to a reduction in resistance, it's called active hyperemia. That is the technical name for it, okay? And active hyperemia, this idea again of kind of vasodilation of arterioles leading to certain areas to allow for more blood flow due to the reduction of resistance, it doesn't just apply to muscle, okay? Let me show you another place where this applies. That is, it's it's resulted in us understanding so much more, for example, about the brain. There is clearly a vascular system that exists throughout the brain. It's part of the systemic circuit. So there are arteries, arterioles, capillaries, venules, and veins that exist all throughout the brain. Like, the brain is the most vascularized part of the entire human body. And here's what happens. We know, through this whole process of active hyperemia, if somebody is using neurons in a particular region of the brain, right, those neurons are going to be generating a high frequency of action potentials. And if they generate a high frequency of action potentials, they also have to consume a ton of ATP, right, to keep repolarizing the axons. So it only makes sense. More active neurons consume more ATP, and thus they have to make more ATP. So what do they need more of? They need more blood, and thus they need more oxygen, and they need more nutrients. So that's where something like functional MRI comes into play. Functional MRI, what it does is it looks at the amount of blood that's flowing to different regions of the brain. And this is the exact same principle that relates to skeletal muscle. It's active hyperemia. So, for example, if you're going to contract skeletal muscles, what's the portion of the brain where neurons should be most active? Right? It should be like here, right, in the primary motor cortex. If you're going to start contracting muscles, then neurons in the primary motor cortex are going to have to start generating a high frequency of action potentials, and thus those neurons are going to start consuming lots of ATP, and they need to make lots of ATP. And in the process of consuming lots of ATP and making lots of ATP, they produce metabolites, just like skeletal muscles do, skeletal muscle cells. And those metabolites, what they do is they leak out of the neurons, and they cause vasodilation of the arterioles that lie around those neurons. And that vasodilation of those arterioles causes a reduction in resistance, and more blood flows to that region of the brain. Right? It's active hyperemia. The vasodilation of these arterioles causes a reduction in resistance and more blood flow to that area. And you can see that on a certain type of MRI. You can actually see those areas light up in the brain, right, when more blood is flowing to those areas, implying that neurons in those areas of the brain are more active. And this is one of the main ways that we know how different areas of the brain do different tasks. So all you do, if you want to figure out what general area of the brain is involved in performing which tasks, what do? You use a functional MRI, and you tell the person to perform those tasks while looking at their brain, right? Let's think of something else. You tell them to solve a crossword puzzle. Okay, that's problem solving, obviously. That's the main area of, you want to figure out which portion of the brain is involved in problem solving. So you give them a crossword puzzle, some sort of game that involves critical thinking skills and problem solving. A Sudoku puzzle, I don't know. Again, this is not my area of research. You give them something that will require them to think critically and solve problems, and you use the functional MRI at the same time to see which area of the brain lights up. Okay, it's going to be somewhere in the prefrontal cortex, right? The anterior association area, as it's oftentimes called. What's going to happen is, while they're doing the Sudoku puzzle or whatever it is, certain neurons in the brain are going to start generating higher frequencies of action potentials that allow you to problem solve and think critically. And as those neurons in the brain generate higher frequencies of action potentials, they're going to consume more ATP and make more ATP, and those metabolites are going to spill out, causing vasodilation of arterioles that lie around those neurons, reducing the resistance and increasing the blood flow to those areas. And you'll see that on the MRI. And then you'll say, oh, that area of the brain is what allows for critical thinking skills and problem solving. So this idea of more blood flowing to muscles, you know, due to vasodilation of the arterioles around them, it doesn't just apply to muscle. It applies to any organ that you want to increase blood flow to. I'm just using skeletal muscle because, well, I mean, honestly, it's my background, so it's easiest for me to talk about. But these principles apply to all the other organs in your body as well. So before I bring this to an end, I want to talk about one more thing, which is, again, mean arterial pressure. You know what mean arterial pressure is. However, it can be referred sometimes to referred to as multiple different things. Sometimes people refer to mean arterial pressure as aortic pressure, or they refer to it as afterload. Let me explain. Okay, so here's the left ventricle, and here's the aorta. Okay, how could you call mean arterial pressure aortic pressure? Well, that's quite simple, because what is the aorta? The aorta is an artery. Okay, it's the largest artery in the human body, but it's still an artery. And what's mean arterial pressure? The mean arterial pressure is the average pressure within the arteries, systemic arteries. Okay? So if you know mean arterial pressure, average pressure within the arteries, then approximately you know the average pressure within the aorta, right? If you know that mean arterial pressure, for example, is 90 millimeters of mercury, you're usually going to measure that by looking at like the brachial artery, and you say, okay, that's the average pressure within the arteries. It's 90 millimeters of mercury. You can extrapolate and you can say, okay, you know, aortic pressure is then approximately 90 millimeters of mercury. It's actually going to be higher than that. But ultimately, that doesn't make a difference. Because if you know mean arterial pressure, you can approximate and you can say aortic pressure, the pressure within the aorta is approximately the same. And then you can also call mean arterial pressure, and thus aortic pressure, the afterload. They all can mean actually the same thing. And then you say, well, what's the afterload? The afterload is the pressure that a chamber has to pump against. Usually we're interested in the left ventricle. So the afterload is the pressure that the left ventricle has to pump against. And what's the pressure that the left ventricle has to pump against? It has to pump against what mean arterial pressure or aortic pressure is, which is approximately 90 millimeters of mercury. Because what does the left ventricle pump blood into? The left ventricle pumps blood into the aorta and thus the systemic arteries. So you say, what is afterload? Afterload is the pressure that the left ventricle has to pump against. And what's the pressure that the left ventricle has to pump against? It has to pump against the amount of pressure that exists in the aorta, which is in artery. So the left ventricle has to pump against what's called aortic pressure, the amount of pressure, blood pressure, that exists within the aorta. And aortic pressure can really just be termed mean arterial pressure. And aortic pressure, or mean arterial pressure, which is 90 millimeters of mercury, equals, right, or is the afterload, the amount of pressure that the left ventricle has to pump against. So you actually can use all of these terms, mean arterial pressure, aortic pressure, and afterload, synonymously. And oftentimes they are. Okay, so the simpler way of saying this is that the left ventricle has to overcome 90 millimeters of mercury of pressure, right? The left ventricle has to overcome the afterload, which is aortic pressure or mean arterial pressure, right? The left ventricle has to overcome 90 millimeters of mercury. In order to get the blood from the left ventricle out into the aorta, the left ventricle, of course, needs to generate more than 90 millimeters of mercury of pressure, and it's going to have to generate much more than that in reality. If the left ventricle doesn't generate more than 90 millimeters of mercury of blood pressure, then how is the blood going to move from the left ventricle out into the aorta? It won't. Like, let's say that the left ventricle were to only generate 80 millimeters of mercury of pressure. The blood would actually flow from the aorta back into the left ventricle. And we know that that actually does happen during relaxation. It's what causes the dub sound. Okay, the semilunar valves close. Okay, so if you want the blood to flow from the left ventricle out into the aorta, you need the left ventricle to generate more blood pressure than exists in the aorta. Right? You need the left ventricle to overcome aortic pressure, also called afterload. And you can imagine, like, what happens during physical activity? During physical activity, you would think mean arterial pressure rises significantly. And you would think, well, why would mean arterial pressure rise significantly? Mean arterial pressure, or aortic pressure, or afterload, as it's called, should rise during physical activity because mean arterial pressure equals cardiac output times total peripheral resistance. Okay? That is how we determine mean arterial pressure. Cardiac output times total peripheral resistance. What do we know happens during physical activity? Cardiac output goes way up thanks to the sympathetic nervous system. And I've said this many times without actually explaining it until the very end here. We would think total peripheral resistance goes way up, right? Because the sympathetic nervous system becomes active and it causes vasoconstriction of all of the systemic arteries. That should drive up the total amount of resistance that exists within the systemic circuit. Both of those things should drive mean arterial pressure way up, and it should make the left ventricle have to work really, really hard. Because let's say that mean arterial pressure went up to 150. Now, the left ventricle is going to have to overcome 150 millimeters of mercury of pressure, right? It's going to have to overcome this aortic pressure or afterload. So now it doesn't just need to overcome 90 millimeters of mercury, it has to overcome 150. So the left ventricle has to contract way more forcefully to be able to generate enough pressure to actually pump the blood out into the aorta. That has the potential to create serious problems because if the left ventricle can't sufficiently overcome the afterload or the aortic pressure, then blood isn't going to be moved out or pushed out into the systemic circuit and the person is going to die. They're going to end up also with congestive heart failure over time because the blood's going to become congested throughout the heart. Not good, very bad. So this is really problematic when we think about exercising, but here's the thing. During physical activity, you get so much vasodilation of the vessels around the contracting muscles that it makes up for the vasoconstriction of the vessels going everywhere else. During physical activity, it's not dramatic, but you actually get a decrease in total peripheral resistance. Total peripheral resistance, you have to realize, is the amount of resistance that exists throughout the entire circuit. So you have to take all of the vessels into consideration. You're getting vasoconstriction of the vessels, taking blood to, the kidneys and the brain and these other locations. But you're getting significant vasodilation of the vessels taking blood to contracting muscles. So you have to take all of them into consideration. And what I'm saying is the vasodilation of the vessels taking blood to the contracting muscles more than makes up for the vasoconstriction of the vessels taking blood everywhere else. So if you do this as a whole, cumulatively, you actually get a slight decrease in total peripheral resistance during exercise. It's not even just slight, it's a decent decrease in total peripheral resistance. But you get a massive increase in cardiac output. So during physical activity, like exercise, thanks to the sympathetic nervous system, as well as contracting muscle, of course, you get a huge increase in cardiac output, and you actually get a reduction in total peripheral resistance. Now, the increase in cardiac output is way more than the reduction in total peripheral resistance, so mean arterial pressure does increase during physical activity. There's no question about that. All you need to do is take somebody's blood pressure during exercise, and you see that it goes way up. But what I'm telling you is, it doesn't go up nearly as much as it could. Okay? Mean arterial pressure rises during physical activity, but in reality, it's actually not that big of a rise. It's only a slight increase. Mean arterial pressure only slightly increases compared to what it could. And that's because cardiac output significantly rises, but total peripheral resistance decreases. And mean arterial pressure equals, again, cardiac output times total peripheral resistance. So if cardiac output significantly increases while total peripheral resistance decreases, then you only, in reality, get a mild increase in mean arterial pressure. And what that does is it takes a big load off of the left ventricle. Again, maybe mean arterial pressure only rises to 120 or something, or 130. So the left ventricle, right, only has an afterload or an aortic pressure of 120 that it has to overcome. If it weren't for this reduction in total peripheral resistance, mean arterial pressure might go up to 250, right? And then the left ventricle would just be, it would be toast. The left ventricle might explode from trying to overcome this massive increase in mean arterial pressure or afterload or aortic pressure or whatever you want to call it, right? So it's really important during physical activity, during exercise, that mean arterial pressure doesn't rise that much, because it would be very hard on the left ventricle if mean arterial pressure were to rise too much, because it would have to overcome such a huge pressure load. So that's the final thing I wanted to say about mean arterial pressure, or MAP. And this yet again explains why you can't think about any of these equations in a vacuum. Because if you were to just think, oh, total peripheral resistance or resistance decreases during physical activity, then you would think more blood flows to everything, right? I mean, of course, that's not what happens. Resistance increases around, let's say, non-essential organs, right? The vessels taking blood to these less essential organs during exercise, they vasoconstrict and the resistance increases. But the vessels taking blood to contracting muscles, let's say the more essential organs during exercise that actually need the blood and oxygen, those vessels vasodilate and their resistance decreases. So in different areas of the body, you get increases and decreases in resistance. I know I've said this a million times, but I'm trying to make the point that if you think about any one of these equations as just a whole body level, it makes no sense, right? Because a reduction in total peripheral resistance would tell the average person, if you just look at the equation, that more blood flows everywhere in the human body during exercise due to the reduction in resistance, which of course is not true. Okay, you have to think about all of these equations. You have to know the equations and know how they influence flow and how they influence pressure, but then you have to think about them as they relate to the human body in different areas and on different levels. In certain areas of the body, vascular resistance is increasing and hampering blood flow. In other areas of the body, vascular resistance is reducing and increasing blood flow. If you think about it all as a cumulative, there's actually a slight reduction in total peripheral resistance, which is very good for the aorta and thus the left ventricle. There's so much more to the dynamics of blood flow that I have not been able to cover over the course of 2 hours. Okay. The vascular system and understanding the dynamics of blood flow, it's incredibly complex. It's sophisticated, as I'm sure you have nonetheless seen as you've watched this. If you feel confused by it, I can promise you 99% of other people do as well, including myself half of the time. So don't feel defeated by any of this. If you get bits and pieces of it, that's great. And as you continue to progress through your education, if you continue on with physiology, you'll learn more about the dynamics of blood flow. And it always makes more sense every time that you get it and every time that you study it again. So I always tend to get a lot of people who are very confused by how to apply all these different equations, and I don't blame them. It would take much more time than we have in this class, I think, to really get everybody feeling comfortable. So again, don't be too worried about it. If you get a good chunk of it, you're in a very good place.